So today we're going to cover a couple of things to give us a basic understanding of what heart disease is. We're going to talk about common risk factors, common complications, some management tips, and some final takeaways. So the normal human heart is a muscular organ, is the size of the owner's fist, and it has its own electrical impulse. It's made up of chambers, it's made up of vessels, and it's a very strong muscular tissue. It beats 100,000 times a day, 100,000 beats a day. You can imagine that for a lifetime. For those of us who are seniors, if you're as old as Nigeria, 64 or above, you can imagine what your heart has been doing for that long time. About 2,000 gallons of blood through 60,000 miles of blood vessels. So a woman's heart, you won't be surprised to hear that, beats faster than a man's heart. Beats an average of 8 beats per minute faster. The sound of your heartbeat is like the clap of valve leaflets opening and closing. When the valve opens and closes, a beat is done. So during an average lifetime, the human heart will have pumped about 1 million barrels of blood. This is why we need to take care of our heart. When we talk about our heart, is the most vital organ. Cardiovascular disease, what is it? Cardiovascular disease are diseases that affect the heart and blood vessels. So heart disease is one of the various forms of cardiovascular disease that affect the heart. I just want us to understand that cardiovascular disease is the general term that disease affect the heart, but heart disease affects the structure and function, and it's one form of cardiovascular disease. Heart disease generally is really more dangerous than breast cancer in women and prostate cancer in men. There are two forms of heart disease: hereditary, also known as genetic, or congenital. And what are they? We have people that are born with structural problems that affect the valves of the heart, or affect the chambers of the heart, or even affect the muscles or the blood vessels that supply the heart itself with blood. So when those things are happening by birth due to various factors, at times it can be fixed surgically, but that's one of the major causes of heart disease. Then we have the familial type, where you have cardiomyopathies that run in families, and that's where there's thinning of the muscles of the heart. And then we have familial hypercholesterolemia, which is a big word to say your cholesterol is genetically high because there's a genetic inherited trait. There's a part of cholesterol that we call lipoprotein little a. That's a subparticle of your bad cholesterol that is genetically inherited. People that have that have tendency to have high cholesterol. To treat this condition of heart disease, there are drugs, there are implanted devices, there are cardio experts in heart surgery, and for the worst scenario, transplants are done for those who can afford it. And of course, lifestyle changes. Now we come to acquired heart disease. What are the things that are in this group? So this is the major part of it is coronary artery disease. This is where the arteries that supply the heart with oxygen and blood becomes blocked and becomes clogged. And when you hear the term heart disease, it's actually what many people refer to. And that's what we're going to be focusing on today when we talk about heart disease going forward. But it's a condition. Another acquired form of heart disease is hypertensive heart disease, which is specifically heart disease that results from uncontrolled or untreated hypertension. Another form of acquired heart disease is rheumatic heart disease, which is very common in developing countries like our own because it's actually due to untreated strep infection. When people have strep infection, some viral infection that is not treated, it migrates to the heart, affects the heart muscle, infection of the heart, and people have heart disease from there. And then you have also nutritional deficiencies. There are a lot of nutritional conditions, coenzyme Q10, thiamine, selenium, that, when we don't have those, the heart beats faster than usual because there's not enough blood, there's not enough nutrients, and people can develop secondary or acquired heart disease. And finally, people can really acquire heart disease from untreated secondary conditions, which I'm going to talk more when it comes to secondary hypertension. Heart disease is often, like I said, when you hear the word coronary artery disease, is a medical term that generally refers to heart disease, even though that's not what it generally connotes, but that's what it is. Coronary heart disease, coronary artery disease, they're the same. Coronary hypertensive heart disease, rheumatic heart disease, disease of the muscles of the heart, also called cardiomyopathies, that are the leading cause of death in Nigeria. And that's why I'm addressing this today. What are the common risk factors of coronary artery disease or heart disease? The common ones that honestly they are treatable, they are preventable, they're controllable. High blood pressure, high blood fat, high blood glucose. Nobody should die from these three conditions because you can live your normal life if you control them well. Now, hypertension is also called high blood pressure. Some people commonly said when it comes to blood pressure issues, they have low blood pressure. Low blood pressure is not really a disease unless your low blood pressure is due to some other underlying conditions. Then, or you're having symptoms, dizziness and falling because of it, you can do more workup. But low blood pressure by itself is not something that should give you concern. The concern is high blood pressure. And there are two types. There is essential, also called primary hypertension. 95% majority of the cases of hypertension is due to essential. It's genetic. I have it, and permit me to say my father suffered from one of the major risk factors I'm talking today, and he lived well till 84 years. You don't have to die from all this. My mother is 84 and she has had heart disease, hypertension, she has had stroke, and she's completely fine by implementing some things I'm going to share with you today. So this is something I have lived. I have had hypertension for more than 23 years or 24 years. And I don't have any complications by God's grace. So I'm going to share these tips with you. So essential, secondary hypertension is when you have high blood pressure due to other conditions that I referred before. It might be thyroid, is overactive. It might be your adrenal gland. It might be other organs of the body, especially the neuroendocrine, the brain and the endocrine system. It can affect your blood pressure. But if you treat the source, the secondary is gone. But essential, there is no known cause for it. You are just having the gene that your parents, who are your sweet parents, transfer to you, but it can also be controlled. Understanding blood pressure readings are very important. You don't check your blood pressure when you have drank coffee or smoked tobacco or all those things that excite our body system, because a blood pressure, somebody that don't have blood pressure is dead. We need our blood pressure to function, for blood to circulate in our body, but there's a range. If your blood pressure on a regular basis is above 140/90, is above 120/129, you are really at risk for developing high blood pressure. So the normal blood pressure is 90/60 to 120/80. Now, to make it easy for you to seek help on time, if your blood pressure is mostly in the range of 130 to 139, which is the upper number, which is actually the pressure when your heart squeezes. The pressure when your heart relaxes is the lower number, which is called diastolic, which is when it's resting. Your lower number should be between 60 and 90. 60 actually and 80. If it's above 80 on the lower number and is above 120 on the upper number, you are in what we call stage 1 hypertension. That's when to wake up and control things. You don't want to wait till you get into stage 2, which is when it's 140 or above, or get into hypertensive crisis, which is when it's above 180. Why do we call high blood pressure a silent killer? Because it doesn't give you any sign until it becomes very, very, very worse in the stage 2 or complicated stage of crisis. When you begin to have headache from hypertension, blurry vision, the damage is already done. So the essence of today is to target and make sure you have your blood pressure controlled and check it regularly. Now, when you check your numbers and your lower one is usually a lot high, it's also a red flag, because that's the pressure when your heart's supposed to be resting. So if it's unusually high, more than the upper number, is also cause to know. So your upper number might be good, but your lower number is constantly high. Is a need to check up. Your upper number is not, the lower number is good, but your upper number is, so it has to be both numbers. What are the complications if we don't control our blood pressure? A lot of things can happen. Stroke. The major cause of stroke in developing countries and developed countries is untreated high blood pressure. Why? Remember, the pressure gets so high, so the vessels that supply your brain become so high, they can develop into aneurysm where they blow up. They can burst where you have bleeding in the brain. And once the brain doesn't get the oxygen it wants, the brain strokes. So that's it. Then you have vascular dementia. What is vascular dementia? You begin to lose memory over time because your blood vessels that supply your brain have become so thickened over the years that you're not getting enough blood supply to your brain, and you begin to lose your memory. And then you have vision loss, you have heart failure, that can result because your heart is pumping more than usual, exerting more energy to pump through all those blood vessels that we narrated before, and they get so tired, and your muscle gets tired, and they can fail. Heart attack, big thing. Your heart begins to, the coronary arteries are the arteries that supply the heart. So when this pressure affects the coronary arteries, they're no more going to supply enough blood to your heart. Once your heart lacks oxygen, the same thing that happened to your brain, your heart, you have heart attack. So stroke can actually be called brain attack, while heart attack is heart attack. Then kidney failure, big deal. Your kidney can fail because there's shortage of blood supply to the kidney. Of course, sexual dysfunction. People are getting old. They are senior citizens. Apart from age, these are things that can affect your sex drive. Now, how do we manage this? I'm going to talk, and you're going to get a lot of information. I'll post this on our YouTube channel because we are going to dwell on lifestyle modification, which will be the next video I'm going to be presenting. But right now, I'm going to focus on clinical, which is medical. There are a lot of medication. You need to see your doctor. Disclaimer, this is not replacing you going to see your doctor. I'm just giving you an idea that there are medicine out there you can take safely. There are various types. Every medicine has side effects, but not all the side effects is going to show up in you, because side effects are symptoms that are collected over population study. Might be one person develops headache from a medicine and there are 1,000 people in that study, they're going to include it. So the fact that you see those side effects, by faith, take the medicine, because the impact of you not controlling your blood pressure and side effect of leg swelling cannot be the same. So, but there are side effects. And then if you have a good doctor, a health provider, they work with you. Most time people start with water pill. If you're the type of person, you're a driver or your work doesn't allow you to urinate, there are other medicine. There are ACE inhibitors, beta blockers. There are examples of this, calcium channel. There are about 7 to 8 categories of blood pressure medicine that if this one doesn't work, this one should work until you have one that matches your body. It's not one size fits all, but they are all targeted to lowering your blood pressure through different pathways in the body. Next is, I will not fail to mention complementary medicine. I'm a big fan of lifestyle modification through the food we eat, the type of quality of sleep we get, the type of way we cope with stressors in life, and the type of exercise that we engage on. When it comes to high blood pressure, there are a lot of studies that are going on now, thankfully, on herbs. Many of those herbs are available in our communities. Herbal remedies, vitamins, and drinks have not been well studied for your safety. But there are a lot of preliminary studies that support the fact that using beetroot, using hibiscus tea, which we call zobo, can help as a complementary, meaning if I'm using it, it can lead to me, instead of taking 2 blood pressure medicine, I might drop to 1. And if I'm doing other lifestyle, cutting down my salt, exercising, and I become normal, I continue to do my checkup, because you can become normal for 3-4 months. God forbid, age, as life issues come, it can go up. It's a silent killer. When it's going up, you're not going to feel it. The only way to feel it is by checking your blood pressure. So complementary, using hibiscus tea, beetroot. Don't add sugar to it. Don't add honey, because you're going to give yourself sugar issues, which we are going to talk with later. Now we're going to look at high blood fat. This is also a part that is the cholesterol in your body. Our body produces cholesterol. The liver produces cholesterol that our body needs for life. But where we get this high cholesterol is from the things we eat, especially animal-based food. So we have various forms. We have healthy ones, unhealthy ones. The healthy ones protect our heart because they really help clean our blood vessel from plaque buildup, from the things that should block it. They go in and wash them out. That's the healthy cholesterol, also known as high density lipoprotein. It's supposed to be a particular number in your system. Then we have the bad ones. The bad ones are the triglycerides. Believe it or not, not only fatty food, if you eat a lot of carbohydrate, starchy food that is excess in your body, you get a lot of triglycerides, which is why we're supposed to cut down on those. Then we have the low density lipoprotein, which is a bad one too. So we have the LDL, very low density lipoprotein, VLDL, the triglycerides. They're bad. What do? They just go in and block those things that healthy one is cleaning, and gradually the lumen of your blood vessels narrows down. There's no blood supply, and that's what causes heart attack. That's why it's a major risk factor for heart disease. So just look at it as bad cholesterol is a plaque. Just like you have plaque on your teeth, things that you want to brush off, that's how they go filling into your blood vessel. And when an artery is blocked, including the artery that supplies to the heart, it can lead to clots. When you see people, some people can have stroke due to blood clots going in and blocking their brain vessels. You can have heart attack because blood clot goes in to block your coronary artery. And then when it happens, the heart muscle is not getting enough oxygen. The brain is not having enough oxygen. The heart continues to pump until it's tired because it's pumping through by higher force to push through the blockage. And that's what causes heart attack, heart muscle damage, and heart failure and stroke. How do you manage high cholesterol? There are medicines out there. There are some alternative complementary herbs out there. Like I said, I'm not a big fan of making specific prescription for herbs. It's something you want to take individual base. Make sure your kidney function is well, because some of these herbs can be overdone. There's no dosage attached to it. It's not well studied like clinical drugs that are being studied and said take twice a day, take 3. So because of those variations that are not standardized, I'm very wary of recommending that. And a lot of fake health advertisements out there in TikTok, a lot of things promising miracle cures. Be very careful. That's why I'm actually going to go through this series. So you have the statins like your Zocor, you have your Zetia, you have the bile acid binding resins. For those who have very high triglycerides, things like fibrates, omega-3 fatty acids. So many of these drugs target LDL or very low density lipoprotein or the high triglycerides. So depending on which one is high, your doctor will make the best recommendation. Anybody that have high blood pressure, high cholesterol should be seeing a cardiologist at most once or twice a year. Now, my favorite one is diabetes. Not my favorite because I want it, but it's really the most complex one that people find difficult to manage. Just because many of our food is heavily starchy. When you serve fried egg and yam for breakfast, fried potato and yam and egg, fried egg and fried potato, it's so difficult for us to access healthy food. And the culprit when it comes to diabetes is really what we eat. So what is diabetes? We have various types. Diabetes is actually the #1 cause of kidney failure, lower limb amputations, and adult blindness. Like I said, my father died from complication of type 2 diabetes. And the complications set in the last few years of his life when he could not anymore kind of comply to or be privileged to make healthy food choices and healthy lifestyle modification that would have prolonged his life. But to me, on average, he died at 86. His complication was the last 2 years of his life, and he lived a good life without any other complications, but it could have been better. So when we have type 1, which is autoimmune. Autoimmune is you're born with it. Autoimmune means that your cells of your body begin to attack its cells. And when it comes to type 1, it's attacking the beta cells of the pancreas. And people are born with either 90% of their beta cells gone or even completely gone. But studies show that at least people are born with little. And if these children and young people are discovered early, they can actually harvest and preserve those cells to for them to use it longer. But bottom line is, it's really common in children and younger population, and it's due to the fact that they have unexplainable absence or loss of beta cells, which is the cells in the pancreas that release insulin, which regulates our blood glucose. Type 2 is the most common, and that's because of lifestyle. Type 2 is because of lack of exercise, the type of food we eat, overweight, which leads to resistance. Our body, now we have insulin, but our body is resisting it. The fatty areas in our body is resisting it. It's available, but it's not converting it to what it's supposed to do. And what happens? It starts floating on our kidney, start floating in our blood, and we start having these complications that we're going to talk about. Then we have another category, which is gestational diabetes. Is actually the diabetes that affects only people when they are pregnant because of the changes in hormone. Though this can be treatable and resolved, is a risk factor for developing type 2 diabetes later in life. So when you already have this, you have to take extra caution. Then we have other types, which I will not mention here, which exist also that affects our blood sugar. So when it comes to type 2 diabetes, which I'll focus more on, it is when your pancreas does not make enough insulin to drive uptake of glucose into the cells, or failure for the fat cells to utilize the insulin that is available well. So this is what happens when we eat that yam or eat that fufu, right? It breaks down to glucose. So it makes our glucose to spike, to go up. So the more we eat heavy starchy food, the more that glucose is spiking. And what happens is our cells need the glucose for energy, and the factory that converts the glucose to energy in our cells is called mitochondria. So when the mitochondria are overloaded because we are eating heavy meal, you have a plate, you have big bunch of swallow, you have rice, especially when we go to parties, and you do this in the morning, your mitochondria gets tired, they can actually die. And when they die, they release all these free radicals, inflammation, and things that affect other parts of our body. But thankfully, God put in our body the pancreas. So when the brain senses that there's a high level of glucose that even the mitochondria is not able to handle, they push it so that the beta cells of the pancreas will release insulin. Insulin says, okay, I'm here to help with the extra glucose. They carry it to the liver to store, because there's too much. All our sugar is still too much, because we ate fufu in the morning, afternoon is rice, night is yam. After the muscle has stored enough they need, after the liver has stored enough, they move it to the muscle. If you're skinny and you don't have or you are too fatty that your muscle, they now send it to the fat. If the fat cells are tired, that's when you come insulin resistance, because the fat cells get overwhelmed, and that's when we have insulin resistance, meaning that despite this storage, they are filled up, and now the insulin is floating in the blood, and it's not supposed to be floating in the blood. That's why it begins to attack the ovary. For women, when it attacks your ovary start releasing testosterone, and many people have polycystic ovarian syndrome. There's a link between it and what you eat and insulin resistance, and this is what happens when it comes to diabetes. Your sugar now begin to spill, and when you check your blood sugar, like in that machine, you'll see go up 140 when it's actually supposed to be more below 100. Now, symptoms: when you have unusually thirsty, you're frequently urinating, you're unusually unexplainably hungry, even you have eaten, you are fatigued. What happens to that fatigue? Science says the mitochondria that's supposed to be your factory energy, you are tiring it. So you get tired, you sweat, unexplainable sweating episode. I know in hot season we sweat, but this one, when nobody is sweating, you are sweating. Unexplainable weight loss or weight gain. Initially, I want to know this, initially you gain weight. When the glucose is now running out, you are peeing your glucose, you start losing weight. So by the time a weight loss is noticed in the process of developing diabetes, it has become worse. So the initial thing is unexplainable weight gain before unexplainable weight loss. Then you have blurry vision. Remember, the insulin is swimming over your kidney, your eyes, and then it's affecting your legs, because it's affecting the blood vessels on your lower extremities, becomes inflamed because of those free radicals that are released, because the mitochondria is tired, and then the nerves begin to die, and that's what causes poor circulation and people ending up cutting off their legs. Healings of your sores are not refused to heal because the cells are feeding on glucose, so it's not healing well. A lot of frequent vaginal discharge or penile thrush is because of too much sugar floating in the blood. So we're gonna just rush this. You're gonna hear from me from the YouTube channel, which I believe that you will subscribe to and get more information on this. The reason we're delivering this is to tell Nigeria that there are so many deaths we don't have to die. Many of us, when we're sick, the first place to go is native doctor. We don't or go to that video somebody sent to you, or drink that concoction. There are a lot of good science out there. My job is to translate those science work, those research, break it down, tailor it to what you can eat, and be providing you this information at free of charge. I don't want us to buy into the fake health advertisement and miracle cures that is not cure out there. So complications, there are a lot of eye problems when you don't control your sugar, kidney damage, stroke, hearing loss, heart attack, food problems, infection, even oral health and nerve damage. You can manage, type 2 diabetes. You can also manage type 1. Type 1, you need insulin. Remember, there's no negotiation. For those that want to run away, you need insulin for type 1. Type 2, you need insulin, but you have to try other lifestyle modifications, the diet, exercise, sleeping well. There are a lot of things that trigger stress hormones in the body, and you want to avoid and minimize that. So there are a lot of medicine. The common one is glucophage, metformin, and the others in the category, actually 1, 2, 3, almost 7 various categories, just like you have for high blood pressure, that the doctor can put you. You need an endocrinologist. If you're diabetic, you need to see an endocrinologist at least once, twice a year, in addition to the general practitioner. Very important. Hypertension, high cholesterol, you need a cardiologist. For diabetes, you need endocrinologist. Now, I told you there are a lot of complications. The common one, we have been talking about it. Many people, I can't tell you many people have lost from senseless death, heart attack, because they so simply could not continue to take care of their blood pressure. So heart attack happens when the flow of blood in one or more of your coronary arteries, which is those major blood vessels that supply blood to the heart, when they suddenly gets blocked and part of your heart is no more refusing oxygen, you begin to have the pain. In women, you might not have the typical grabbing of your chest like that picture, that it can be your jaw pain or left hand pain or heaviness. You don't have those pictures, but most time in men, you have that sharp pressure in your chest that feels like heartburn, but it's pressure squeezing. It's important. If you have aspirin at that time, take 81 milligram of aspirin, which we call baby aspirin, about 4 of them at a time. Take it, call the doctor, and go to the hospital. Stroke, the same thing. I call stroke brain attack. Time is of essence. Once you start having drooping, you start having weakness in your arm, you start having mobile speech, you can't speak well, it's time to call. What happens? Stroke can occur when blood flow to the brain is blocked, or there is sudden bleeding in the brain. And you need to recognize stroke symptoms fast and call and get to an intensive care. The same thing, take aspirin. Why do we take aspirin? It helps to at least thin up your blood quick. 4 tablets of aspirin at 1 milligram, and then seek help. Heart failure, that's the end point of heart disease. When heart disease is not controlled, the muscle fails and the organ called heart fails as a pump, so they can't squeeze and relax effectively, and there's going to be build up congestion in your kidney, congestion in your stomach, congestion in your lungs, because that's where the heart pumps and goes to those areas. So when it's no more forming, there's a backlog, there's enlarged heart, there's swollen legs, there is a discoloration, and there are various classes. There's class 1 up to class 5, but class 1 and 2 can be controlled. You can remain in class 2 for a long time. The fact that you have heart failure does not mean it's death sentence the next day. You can actually live and in class 1 and class 2. When it's class 1, you can still move around with no symptoms. You are not short of breath. But when you start having symptoms, when you are rest, you are breathing, your leg is swelling, you turn this right, then that's the end stage of heart failure, and is equivalent to somebody who has end stage cancer that can no longer be treated. As a matter of fact, at stage 4, you are supposed to be in hospice, waiting to die. Now, I just want to give us, when it comes to lifestyle modification, I have this acronym NEST: nutrition, exercise, stress, and sleep. If you can handle these 4 things, and don't start, I mean, I know we say, oh, I'm 60, I'm 70. You can still make those little changes. That's what we call in public health primary, secondary, and tertiary prevention. Tertiary prevention is, yeah, I have the disease. Yeah, I have the risk factors. Even age is against me. But you can still live a good quality life with those diagnoses, with those conditions. You don't have to die from a disease that you have been diagnosed. You can die the God-given time. And even if you live 90, 100, the goal, what I wish for every Nigerian senior, is that we die with integrity, we die with dignity, and we don't have to be sick to die. And our life is not dependent on diagnosis. So there are a few things when it comes to food that I will tell you. If you have to eat, let's say we have a lot of vegetable, we have nchanwu, we have okazi, we have otazi, we have bitter leaf, we have a lot of vegetables in various parts of Nigeria that is seasonal. Make sure you have a lot. Invest money on vegetables. There is cucumber, there is garden egg. Peel them, eat it first before you eat any meal. Then don't eat your starchy food by itself. If you have to eat fufu, make sure if it is unripe plantain fufu is better, because that's what we call glycemic index. The rate at which the glucose is dumped into your system is slower when you have to complex carbohydrate. But if you go with semovita, semolina, and this, the glycemic index is not is very high, so it dumps easily and overwhelms your system. So if you have to eat those food, if you cover them with a lot of vegetable soup and you're eating it along, it masks it and slows down the sugar getting into your system. Don't eat your starchy food by itself. Eat food in the right order. Eat your veggie, protein, which is your meat, or fish or crayfish, or even locust bean. If you don't have fish, those things are healthy. Those things we have, is healthy. Or all those things, you eat it first and then eat your carbohydrate. I know we are Africans, we are Nigerians, we swallow. It's okay if you are swallowing, but make sure you have all this to cover it. You can eat tasty food for your breakfast, but avoid sweet and salty food, especially for breakfast. Move your body after eating. I know some of us might have cane, walker. Simply moving your hand up, sitting up and just squatting on your legs or moving your hips. Any little movements, any small change you can make, it matters a lot. Simply doing like this, if you can move your hand, you can do that. I will, in my next video, I'm going to really dwell on lifestyle modification, but cut down your salt. Salt is not your very good friend if it's not needed. Don't add salt to your food after you have finished cooking. The best time is when you are cooking. Try an apple cider vinegar. Try a teaspoon, a tablespoon, a cup of water before you eat. 10 minutes before you eat your food, it cuts down your glucose at night. Salt is not a good friend when you have high blood pressure. Sugar is not a good friend when you have diabetes. Fatty food is not a good friend when you have high cholesterol. Now, these are my final takeaways. And this is actually what I want to share today. And this is what actually motivated me to start this series of health information. I see a lot of advertisements, a lot of TikTok videos, a lot of Instagram videos, Facebook, people posting a lot of things that, oh, this will cure you, this will cure you. And because we are getting old, we're desperate to live, we don't check out those information. So this is a quick way for you to know whether health information you are getting online is reliable. Make sure you are sticking to trusted sources. There are a lot of trusted sources. The Federal Ministry of Health Nigeria, World Health Organization. I can give you those information more in my next video. But avoid sources that use dramatic headlines that promote miracle cures. Check the date of the information you are looking at. Seek out community resources. There are a lot of health professionals around you. There are a lot of healthcare providers, physicians, pharmacists, nurses. If my car breaks down, I'm clueless about cars. I'll be a fool because, oh, I went to school, I'm a public health expert, and I start fixing my car, I go to the mechanic, somebody who's an expert in that area. So the same thing with health information. Don't just grab what you see on Google, or you ask AI, or you ask whoever, and these things are not verifiable. And many people are posting videos there to make money. You know that. Many influencers are selling a lot of information. You don't have to buy into those, because this is your health. Your health is your wealth. And knowledge, good knowledge is power. Check for the credentials of the people peddling those information. Look for clear language and verify the claims. If a drug company is, if a food company is advertising a particular food they produce, there's a bias already there. And that's why my job as a global public health expert, who has spent so many years studying how food can be used as medicine, who have also studied how research, well-designed research, can inform some good health lifestyle modification. My duty is look at those meta-analysis, look at those randomized control trials, studies that have been done, analyze them, and share the findings, results to tell you this is what you do is backed up by science. You want to adopt behavior that is time-tested, that is backed up by science. In rounding up this, the heart is one of the interesting organs I like to talk about. But guess what? The heart is also used at times for our mind. And it's interesting how our mind, our heart, which we can also call our soul, is related to the physical heart. If you have a lot of resentment in your heart, if you have a lot of unforgiveness, it squeezes you. You have a lot of jealousy, a lot of things. You don't want to see people do well. You are so unforgiving. You are angry with a lot of people around you. You are frustrated. Those things squeeze your blood vessel. It's so interesting how your mind and your heart works. And that's why I am a big advocate for utilization of faith. Your spirituality is a big component of you. Let nobody lie to you. You are body, soul, and spirit. So a lot of connection with what will make your heart healthy is related with what will make your soul healthy. So I just want to leave that out there. I want to just share about who we are. We are Age with Grace Health Services hosting this program, and our job is to provide nursing care, medical care, home health. If you have elderlies that need help in their homes, we provide the nursing, we provide assessment, we have a medical director, we have a registered nurse, we have caregivers who are trained and certified, and we provide these certification training programs and advocacy programs like this. We want to hear from you. We have made some talks in the past on prostate cancer awareness. We have talked about breast cancer awareness. We have talked about health issues, dementia and Alzheimer, things that particularly affect people as they get older. You are seasoned citizens. There's also a lot of discrimination I see in the system because people are getting older. We are here to be your advocate. We are here to attend to you. And you can always check on us. You can Google us, you can go to our website, and we're going to send you more information. Age with Grace Health Services, you can hit us on our Facebook page. Again, I want to say on behalf of Age with Grace Services, Nigeria, I had my education at University of Ife, Great Ife, now Abofemi Awolowo University, and the best university ever. You gave me an education, and I told myself I will give back to Nigeria. So every Independence Day, I will be sending information to say we're doing well. Happy 64th birthday.